Welcome to This Explainer. I'm a pelvic floor physiotherapist, and I want to start off by saying something you probably haven't heard enough lately. Nobody warned you that your body would feel this different postpartum. If you're navigating these unexpected changes right now, please know you found a really safe, nurturing space. Today, we're diving into a comprehensive guide to perineal scar rehabilitation and recovery, drawing from the incredible resources at Ova Women's Health.
So is postpartum pain normal? It's the question literally so many new mothers quietly ask themselves. And I want to just pause for a second here to validate that concern. Yes, some initial discomfort is totally a natural part of healing after birth, but ongoing pain, especially when you sit down or try to return to intimacy, that is not something you just have to quietly accept. Your body has done something absolutely incredible, but lingering pain is simply its way of saying it needs a little extra support.
Section 1, the postpartum reality. For so many women, the reality of perineal healing involves these really silent struggles that can feel incredibly isolating. You might be experiencing some very real physical symptoms right now. We're talking about painful intimacy, the medical term is dyspareunia, or maybe just a deep discomfort when you're simply sitting down to feed your baby. You might even feel hypersensitivity, numbness, or this really uncomfortable sensation of pulling or restriction down there. Please hear me when I say this. This is a recognized physical issue. It's absolutely not in your head, and what you're feeling is completely valid. If you're nodding your head right now thinking, yes, that's me, I want you to take a deep breath. You are absolutely not alone in this. So many women feel totally overwhelmed by their physical recovery. But feeling this way right now, it doesn't mean you're going to feel this way forever. Moving right into Section 2, why perineal scars actually hurt. Because understanding the why is really the very first step toward healing. Childbirth is, of course, a beautiful, natural process. But wow, it can definitely leave physical marks. The most common culprits for perineal scars are vaginal tears, which can range anywhere from a first to a fourth degree, or episiotomies that were performed during labor. Scars can also pop up from surgical procedures or other types of pelvic trauma. Basically, these events end up altering the natural mechanics of your very delicate perineal tissue. Think about the difference between healthy tissue and scar tissue. Healthy pelvic tissue is amazingly flexible. It stretches and moves right along with you. Scar tissue, on the other hand, is a bit stubborn. It's stiff. And when we leave it untreated, it creates tension, restricts your mobility, and leads to that frustrating pulling sensation throughout your entire pelvic floor. If any of this is hitting close to home, please save this explainer and stick with me here, because understanding the problem, that's really only half the journey. The next part is where the magic happens, because we're going to get into actionable solutions and the actual relief that is entirely possible for you.
Section 3. How physiotherapy heals scars. This is the turning point where we shift from just understanding your pain to actively exploring evidence-based ways to find relief.
So, how exactly do we treat this? Well, it usually starts with scar tissue mobilization. Now, I know that sounds super clinical, but it's actually just a very gentle, targeted manual technique. And no, it does not hurt. The whole goal here is to carefully reduce the sensitivity of the scar, boost its flexibility, and get that blood flowing again. This safely breaks down those restrictive adhesions so that moving naturally feels comfortable once again. And here's the thing. Scars don't just affect the skin. They actually change how your pelvic muscles behave underneath it all. Some women develop overactive muscles, which leads to this chronic tightness and tension as the body tries to protect the painful area. Others might experience weak muscles and poor coordination. Physiotherapy gently retrains both sides of the coin, helping to restore comfortable bladder, bowel, and sexual function. Another incredibly empowering tool we use is called biofeedback. Honestly, forget how medical that word sounds. It simply means helping you connect your brain back to your pelvic floor. It lets you actually understand how those muscles are functioning in real time, teaching you how to consciously relax those tight, protective muscles hugging your star. Sometimes, after trauma, the body's nervous system kind of gets stuck in this hyperprotective pain loop. That's where nervous system desensitization comes into play. Using very graded, super careful techniques, a physiotherapist helps calm those hypersensitive spots. It essentially retrains your brain's pain signals, safely bringing back comfort and normal sensation to your perineum. Section 4. When to seek help. Let's talk about the signs that you might need a little extra care and when it's time to bring in professional support. If you're dealing with persistent tenderness, a genuine fear or anxiety around anyone touching your perineum, difficulty sitting comfortably, or even lingering issues with incontinence or your bowel movements, these are red flags. Even if you are many months postpartum, These symptoms are a clear signal from your body asking for specialized support. I really want you to take this next point to heart. It is never too late to heal. Whether you gave birth 6 weeks ago or literally 6 years ago, scar tissue remains incredibly responsive to manual treatment. You absolutely have not missed your window for recovery. Profound, lasting healing is still very much possible. Section 5. Healing at OVA. Because having the right partner in your recovery really makes all the difference in the world. At OVA Women's Health in Burnaby, BC, our entire focus is on specialized whole woman care. Our physiotherapists specialize in exactly this kind of postpartum healing. We truly understand the physical and the emotional toll that birth trauma and perineal scarring can take, and we're completely dedicated to helping you reclaim your comfort. The approach here is wonderfully different. An appointment is unhurried, deeply empathetic, and 100% free of judgment. We use gentle, evidence-informed manual therapy, but we mix that with a whole-body perspective. We're looking at your posture, your nervous system, and your unique birth story to build a truly personalized plan in a private, highly supportive space. We've tried to make it as simple as possible to take that very first step. You can use the QR code here to go ahead and book your first visit. Your initial appointment at OVA Women's Health is going to be warm, conversational, and tailored entirely to your comfort level. We always move at your pace, no rushing. Remember this, you deserve to feel supported in your own body, not just patted on the hand and told your pain is normal. You deserve to reclaim your comfort, your confidence, and your intimacy. And our dedicated team is right here, ready and waiting to help you do exactly that. So I want to leave you with this final thought for today. What if you didn't have to just live with it anymore? What if real relief is literally just one appointment away? Thank you so much for spending this time with me during this explainer. Be kind to yourself, honor the incredible work your body has done, and when you're ready, reach out. Healing is waiting for you.